Focus on the digestive juices, which are just liquids that are made and secreted in various areas of the body to help with the digestive process. That might be the mouth, the stomach, the small intestine, the liver, the pancreas. They all do this job. So specific examples, I did name a lot more than this, but the ones I want you to focus on are the salivary amylase, which remember was the first part of chemical digestion, which occurs in the mouth itself, breaks down carbs. Hydrochloric acid is a digestive juice found in the stomach. It has two main purposes. One is the acid will kill off bacteria and pathogens in the food that you eat to try to prevent you from getting like GI bugs all the time. And then it can also help with chemical digestion by activating other enzymes. Bile is another very important digestive juice. It's made in the liver, it's stored and concentrated in the gallbladder, and then the gallbladder will release it via these little ducts into the small intestine. And bile, important to know the function of it, breaks down the fats that you eat in your food, so it helps with the chemical digestion of fats. The accessory organs that we talked about were the liver, which is located in the right upper quadrant, that big organ in the right upper quadrant. So again, we talked about how it produces bile, which helps with fat breakdown, but it does a lot of other stuff too. It's really it's a filter, so the removal of bacteria and toxins from the blood is an important function of the liver. That's why people who abuse alcohol and things like that have liver problems, because their liver's been overworked by all the filtering it's had to do. It also produces proteins that help your blood clot. It also produces a substance called heparin that helps your blood not clot, produces cholesterol, and then it stores some things like sugar, iron, and vitamins. The gallbladder is located in the right upper quadrant as well. It's attached to the liver. It's much smaller than the liver, and it's a little pouch where the liver will send the bile after it's been created. So the gallbladder will store the bile and concentrate it and then release it into the small intestine when it's time, when you have food present in the small intestine that needs digested. The pancreas was the final accessory organ that we talked about. It's located behind the stomach, which is technically considered like the left upper quadrant, but it's kind of right in the middle of the upper part of the abdomen. The pancreas does two major things, produces all sorts of different enzymes, and then it'll have a connection to the small intestine to release those enzymes to help with chemical digestion when there's food present. But it also has a function, and this isn't really a digestive system function. This is what's called an endocrine system function, which we're not going to get to this year, but we will cover eventually. Endocrine system is the system for hormones, and the hormone that the pancreas produces is called insulin, which you've maybe heard of. That's a medication that diabetics take, but it's actually also a hormone that your body should naturally produce, and it's released into the bloodstream to help control your blood sugar levels. Then we moved on to diseases and abnormal conditions. So we'll start with diarrhea, which is the opposite of the second condition, constipation. Diarrhea is when you have frequent liquid bowel movements from intestinal irritation, and the peristalsis in your GI tract is just going crazy fast, because your body's trying to remove whatever is causing the irritation. This should be intolerances. From food intolerances or infections or meds. So again, the body's trying to speed things up and get it out. The best treatment is to try to rest the system, and then we want to make sure we're staying hydrated, because people, especially really old and really young people, are prone to dehydration when they have diarrhea. You're losing a lot of fluid. Constipation is the opposite. We have slowed peristalsis, or for some reason the large intestine's moving slowly and stool spending too much time in there. If you think back to what the large intestine does, it reabsorbs water. So if stool's sitting in the large intestine too long, too much water is going to get pulled out of that stool. The stool's going to become hard, and that's when it's hard to have a bowel movement. So the diet plays a big role in constipation oftentimes. If you're dehydrated and you're not eating much fiber, then you are more prone to constipation. Also, if you don't move around too much, peristalsis will be slower. Certain foods, meds, and also stress can lead to both constipation and diarrhea. So to treat it, we want to focus on a better diet and mobility. Hernias are, remember, hernia means rupture, so this is when we have one body part rupturing through another part. Oftentimes when we think about hernias, we're thinking about intestines popping through the abdominal muscle wall, so you can kind of see this outpouching on the belly somewhere, still covered by skin, but it can happen elsewhere. It's dangerous if that body part gets kind of stuck and twisted in the body part that it ruptured through, because then we can lose blood supply to that organ, and if that organ starts to die, death will spread to anything it's connected to. So the examples from the PowerPoint, we talked about hiatal hernias, which were the special ones at the top of the stomach. So the top of the stomach pops up through the diaphragm towards the esophagus. Inguinal hernias are in the groin region. Umbilical hernias are like where the belly button is. You have a popping out of intestine through that region. Hemorrhoids we talked about next, which were your varicose veins. If you remember back to cardiac, varicose veins are just stretched out blood vessels. But these hemorrhoids occur in the rectal or anal areas. Constipation and overstraining can lead to hemorrhoids because you're putting a lot of pressure on the blood vessels in the area. Pregnancy also has to do with a lot of different blood flow issues and extra pressure in areas, so you're more prone to hemorrhoids during pregnancy. Ulcers are usually found in the stomach if we're talking about ulcers in the GI tract, and when they're in the stomach, we call them peptic ulcers. Usually they're caused, especially peptic ulcers, are caused by a bacterial infection with the bacteria called H. pylori, so we would treat it with an antibiotic. Signs and symptoms of ulcers are burning on an empty stomach. So remember, when you have food in your stomach, it helps coat the stomach and lines the stomach, but when your stomach's empty, now we just have acid sitting in there with nothing to do, so it's just going to burn that ulcer even more. Diverticulum and diverticulitis. The diverticulum are the pouches that form, and that's abnormal. You shouldn't have pouches in the lining of your intestine. It usually occurs in the large intestine, but it can also be in the small. Diverticulitis is really the big issue then. If you have diverticulum and the diverticulum pouches get filled with stuff and stuff gets stuck and starts to rot and gets inflamed and infected. So you have an infection of the diverticulum pouches with diverticulitis. Crohn's disease is a long-term chronic disease, so it's not curable. It usually comes and goes in waves throughout the life. And then it's inflammation, irritation of the intestines. It's thought to possibly be an autoimmune disease, which means the body's attacking itself. It also might be food allergies, but we do know that people with chronic stress seem to have it more often and worse. So signs and symptoms are the stool is going to be gross because of all the ulcers that have formed in the colon. So the bloody and mucousy ulcers are going to be, and pus are going to be present in the stool. It's a painful condition. Think about when you have an ulcer in your mouth and you have tons of those in your, think about if you would have tons of those in your GI tract. It would be very painful. And then you're prone to losing weight because of your stool issues. Irritable bowel syndrome is kind of similar, but it's not like a chronic, and it's not a condition we can like look at and see it for sure. We just have to go based off the patient's symptoms. But we know that the large intestine is irritated. We know that people with stress are more prone to IBS, and then it can lead to constipation and or diarrhea and just uncomfortableness in the abdomen. Acid reflux or GERD. GERD, remember, gastroesophageal reflux disease. The problem is the stomach contents reflux back up into the esophagus. So if you think about what might be causing that, one would be there's a sphincter muscle there. The lower esophageal or cardiac sphincter is supposed to prevent that from happening. So it might be weakened or it might not be functioning correctly, but also hiatal hernias at the top of the stomach. If the top of the stomach's kind of bouncing up through the diaphragm, that can also lead to acid reflux and GERD. Heartburn's the big sign, especially after eating, because when the stomach's full of things, those things are more likely to kind of go back up into the esophagus. So we want to do small, frequent meals instead of overfilling the stomach. Sitting up after meals to help gravity just kind of keep things moving downward. There are medications and surgical options if this is severe.